Hi guys, it's Amy and welcome back to my channel, Honestly Invisibly Sick. And in today's video, we're going to be discussing rheumatoid arthritis. But before we get into that, I just want to get my disclaimer out of the way. I am not a medical professional. This is just my story and what works for me. And me trying to explain it. Oh. What rheumatoid arthritis is, it's an autoimmune disease. Much like if you watch my lupus video, it's where your immune system is triggered. We don't really know what causes rheumatoid arthritis, but it's along the same lines as lupus. Most of the time you carry the gene, and for whatever reason, whether it be environmental, stress, an infection, or whatever, it's a switch that's triggered in your body or that's flipped in your body, and it causes the disease to become active. I am not rheumatoid factor positive. I am actually rheumatoid factor negative, and I have been every time that I get checked for rheumatoid arthritis. I am rheumatoid factor negative, but that doesn't mean that you don't have rheumatoid arthritis. I think a lot of times doctors kind of get hung up on the blood work so much that a lot of people that have rheumatoid arthritis or even lupus kind of get overlooked a little bit because you don't have that particular, you're not positive to a particular, like your rheumatoid factor or your ANA. I know my ANA, whenever I first had it checked, it was a little bit elevated, but then they didn't really think it was significant. So when I went to the new rheumatologist that I see now, she checked it again and it was more elevated, and she also took into account my symptoms. When I walked into this lady's office, I was already on a cane and I could barely move. So she took into account those symptoms and all the things that I was telling her. But a lot of times, like I said, the rheumatologist gets so hung up over the blood work that they can't see past it. But you can have rheumatoid arthritis and not have a positive rheumatoid factor. It is totally possible. Like I said, mine came up negative for years. It's still negative. Sometimes it takes a long time for your rheumatoid factor to even show up positive. Not everybody's body is different. Some people can have joint pain and go and have the rheumatoid factor checked, and it pops up right away. And then some people can have significant joint damage and go and have their rheumatoid factor checked and it show up negative. So it just depends on your body. And I think a lot more research needs to be done on that with the seronegative rheumatoid factor. But I have had rheumatoid arthritis. I think that's what triggered actually in 2014, if you guys remember from my intro video. I think that's what was triggered, was the joint pain in my hands, because before that I had never had joint pain on that level. I believe that I've had the lupus for a long time. I just believe that at that particular time the rheumatoid arthritis was triggered, because that's whenever it really started getting prevalent and I really started having difficulty moving around. Like I always had the pain, like I said before in my lupus video, I'd always had the pain before, but never to the extent as it was in my hands. But my eye doctor knew that I had rheumatoid arthritis or some type of autoimmune disease, and that's actually how mine first started. And I first found out that I had it was because I had a really diligent ophthalmologist who knew what he was looking for and knew what he was looking at. And the sad part was that I couldn't get a rheumatologist to listen to what my ophthalmologists were saying, because I had already been sent up to university and they said, yes, in fact, this is an autoimmune disease that is causing this with her eyes. But because sometimes doctors don't like to listen to other doctors because they really feel strongly that they have or that they know what's going on, it kind of just leaves the patient kind of hanging in the balance, and that's what happened with me. But anyway, back to rheumatoid arthritis. Rheumatoid arthritis, as I said, is an autoimmune disease, and whenever this switch is triggered in your body or turned on, it causes your immune system to be overactive, and there really isn't any bacteria or virus in your body that your immune system can fight. So it starts to attack your joints, and this is caused by inflammation. That's what causes the inflammation in your joints, is because your immune system is attacking that joint. Much like how if you have a sore and you see that it's really red around the sore as it's healing, well, that's your immune system doing what it's supposed to do to heal that sore. Or like if you have a sinus infection and you have inflammation in your sinuses, well, you have the inflammation because your body is doing its job to fight off this infection or this virus or this bacteria or whatever it is. So that's what happens with your joints. And rheumatoid arthritis has some pretty specific symptoms. Usually if you have rheumatoid arthritis, like I said, you get like, it gets inflamed, your joints get red, they get swollen, they get hot. Also, if you have joint pain on one side of the body, sorry, that's my phone, you're probably going to have that same joint pain on the other side of your body, so it kind of happens at the same time on both sides of your body. For me personally, I have the joints that I have, almost all of my joints have been affected by rheumatoid arthritis. My main ones that really bother me and give me a lot of trouble are my feet joints, mainly the toe joints where the toes meet the foot. My pinky toes are the worst. My right pinky toe is so bad, or it gets so bad when it's flared up, that I can't even wear tennis shoes. Also, my big toe on my right foot as well is really bad. That's what caused me to have a limp for so long, and I had to be on a cane because of those joints in my feet. And well, mainly my big toe, but my pinky toe, like I said, I couldn't wear any shoes that touched it because it would really bother it. So I had to wear flip-flops all the time. I can wear tennis shoes a little bit now that I'm on the Plaquenil, but they're still pretty bad to wear. I don't like to take, sorry, I bumped the camera again. I don't like to put any tight shoes. Like, I like to give space. Like, even my boots have a big toe area because I don't want anything touching or rubbing up against those joints, because I know that it's going to hurt really bad. Also, I have where the joints in my fingers are affected. I actually have some damage to my joints, to a couple of my fingers because of it, and I'll show you. I want to show you guys too today. My hands are hardly swollen at all. If you look, you can see all the extra skin on my fingers and my hand, and that's because it's constantly swollen. Look at my ring. It could almost fall off. This is a size 9, and I normally wear a size 7, but I had to get it sized up 2 sizes so that it would stop getting stuck on my finger. And this is my more prevalent hand. My right hand is always normally swollen, and it's not really today. It's a little puffy, but it's not bad. And you can see, like, just the skin is like crepey, just because it's just they're constantly swollen. And I just think it's so neat whenever I get to see, you can really see how crepey it is, whenever I get to see my hands where they're not swollen, because that hardly ever happens. Like, normally I have like sausage fingers, they're so swole. But you can see, like, right here, if you see the little curve right here, that is joint damage due to my rheumatoid arthritis. I'm starting to get it a little bit on this one, but it's not too bad. And this is another symptom of rheumatoid arthritis, that your fingers start going towards your pinky, and that's another symptom of rheumatoid arthritis. I don't know why it's more prevalent that they go that way, but it just is. If you look at it, you can see that it goes that way. I have the same on this hand. It's not as bad, but you see that knot right there, like that's from the joint damage. I have this one as well that you can see the knot on, where it goes that way, but they both kind of go that way. This one is worse than this one, but you can see that they kind of go that way. Also, this finger right here is twisted. You can't tell probably because I just cut my nails off. I wish I wouldn't, but my nail grows kind of like this way because the finger is twisted, and that is due to the rheumatoid arthritis. This one does it a little bit, but not as bad to the extent of this one. But I also have pain. You can get pain in your jawbone, in your joints of your jaw. I've had that happen. You can get, obviously, any of your joints are up for grabs, but I just want to tell you the main ones that bother me. My hips bother me, my knees have bothered me for a very long time. I actually get shooting pains sometimes in my joints. Mainly it's like the bigger joints, like my elbows and my hips and my knees. My knees are more prevalent because I guess because I move around more. I'm not exactly sure why it attacks my knees more, but I get these shooting, stabbing pains, and these pains stop you in your tracks. Sometimes it's hard to even catch your breath whenever you have one of the pains. It just kind of takes your breath away and just kind of goes, it just goes in, and sometimes it lasts just like a second, and it's like, okay, I feel better, or it feels better, and sometimes it lasts for longer, and sometimes it'll last for a second, and then it'll keep coming back for a few minutes, and it's quite painful. But like I said, you get, the symptoms that you get are just being red and swollen and just hot to the touch. Also, much as how lupus can, rheumatoid arthritis can cause problems with your lungs and your heart because it's an autoimmune disease. It's normally not as prevalent as it is in lupus. Lupus just covers a wide variety or a wide gamut of symptoms and tissues in your body because it attacks in a different way. Whereas rheumatoid arthritis kind of goes after your joints, lupus kind of goes after your tissue. So that's what happens. But it can, like I said, you can get the pleurisy. As I mentioned in my intro video, you can get that with rheumatoid arthritis. You can get the eye conditions with rheumatoid arthritis as well. That's what my eye doctor first thought I had. Lupus never even came up. He really thought that it was rheumatoid arthritis because I kept having the iritis in my eyes. Sorry, my eyes are watering. If you don't know what's going on with that, go back and check out my eye video. I'll put it in the description down below. But yeah, you can get the eye conditions. You can get chronic dry eye that goes along with having rheumatoid arthritis. It also goes along with having lupus. So as for me to know which one causes which, I think that all works together to attack my body in different ways. I do get stiffness with my rheumatoid arthritis, but not to the extent that I get with the lupus. The lupus is what keeps me from moving around whenever I have a flare, but they kind of do work against each other. I know I'm really sensitive to cold with my rheumatoid arthritis. I have to cover my feet at night with a blanket, like an extra blanket, a really thick one, because if the cold air gets to my joints and my feet, they will just throb all night, the joints will, and I will get no rest. My hands are kind of the same way because of my hand joints or finger joints are the same way. Because I can't really put my hand in anything cold, like to patty out hamburgers, and that sounds so crazy, but to patty out hamburgers is so excruciatingly painful if it's cold. If the hamburger meat is cold, anything cold like that just really, really bothers my fingers. It just makes them it just gets in there, it makes them really achy, and they throb, and I just have to go put warm water over my hands until they get some relief. Also, rheumatoid arthritis can cause cramping in your hands and cramping in your feet. I get the cramping in my hands quite often. And it makes it to where I can't type. I type, but I have to be careful. I can only do so much at one time because my hands will cramp up. I can't write hardly at all. I don't write very long. If I can, I'll try to type it out. Sometimes I'll have a good day and it won't bother me. Like today, probably it wouldn't bother me because my hands aren't that bad. They're not that swollen, or any of the joints aren't swollen. So I'm so thankful. You guys don't understand how excited I am to get to see my fingers because I never get to see them. But it is kind of drier right now, so that might have something to do with my lupus not being as swollen. But I also used to paint. I used to paint all the time. I love to paint, especially beach scenes. Um, and I don't paint anymore because my hands cramp up so bad. On my makeup video, I was so shocked that I was able to do that and my hands didn't even cramp up while I was doing it. I was like, oh my goodness, because I usually have to stop if I'm straightening my hair, or I don't even blow dry my hair. I'm not even going to lie to you guys, because I'm not going to do that. It just tires my arms out, and they'll be exhausted and my hands will cramp up. So I don't even blow dry my hair. But yeah, if I were to do that or try to curl my hair, I have to take a lot of breaks. And that's not just due to the rheumatoid arthritis. That has to do with the lupus and also the fibromyalgia just making my arms tired. I just can't lift them up very much, and I don't have that much strength in my arms and my hands. Also, the rheumatoid arthritis attacks my joints quite a bit. They are swollen and inflamed, and it also attacks my ankles. My ankles will be swollen, really swollen and hot, and I think that's about all that rheumatoid arthritis attacks in my body. Other people may have it different, may have different symptoms. It's hard sometimes to know what is the lupus and what is the rheumatoid arthritis. Knowing that my joints are hot or inflamed, that kind of helps me to differentiate between the two, to tell the difference between the two. But other than that, I think that about covers it. I don't have like the hair loss and stuff like that like I have with the lupus. Like, it just covers, lupus covers such a wide variety of your body. But the rheumatoid arthritis and the lupus definitely do work together to kind of attack. I will say that the you do get arthritis with lupus, but normally, usually, the arthritis that you get with lupus does not leave permanent joint damage such as the rheumatoid arthritis does. Thank you guys so much for watching this video, and I hope that it did shed some light for you or help you out or give you some kind of encouragement. I'm here for you. I have, like I said in my last video, I have multiple autoimmune diseases, so maybe we don't have the same thing, but I'm still here to support you because I know how it is when you don't have support, especially when you are surrounded by people who don't know about rheumatoid arthritis or lupus or fibromyalgia or any other kind of autoimmune disease. They just don't know about it. That's okay. You can come here and find support, because most people that are going to follow my channel are going to know about it, and you can just find a support or a community of support here. And I want you to also encourage you, if you need prayer for anything, just put that down in the comments section below, and I'll be happy to pray for you. And don't forget to like and subscribe this video if you haven't subscribed already, and check out my Facebook. It's Honestly Invisibly Sick, all one word, Honestly Invisibly Sick, much like my YouTube. And you can also look for the same logo that I have here on my YouTube. That's the same logo that I have on my Facebook. It's that butterfly. So you can look for that same logo. And I think that's it, you guys. Thank you so much for watching. If you're having a bad day, just keep your head up. It's going to get better, and it's going to get better. These are just seasons. They're just flare-ups, so they just last for a little while. Even if a flare-up lasts 2 years, you know that the flare-up is going to end. So just keep working at it. Keep going back to your doctor and working with them, what they want you to take, and just stay vigilant on it. Okay? Thank you guys so much. Have a blessed day. Bye.